Opened in 1961, Community Medical Center has evolved into a 592-bed, fully accredited acute care teaching hospital offering residents highly sophisticated medical treatment close to home. The emergency department at Community Medical Center sees nearly 75,000 visits a year, making it one of the largest providers of emergency care in New Jersey, with highly skilled emergency medicine physicians, nurses, and ancillary staff. With the support of the Hirair and Anna Hovnanian Foundation, Community Medical Center is renovating its emergency department to ensure that every incoming patient receives the prompt, exceptional care they deserve.
So the care I received was, I guess, the two most defining words I would use would be prompt and professional. Everyone was, from start to finish, really professional, and you could tell, one, they cared about me, but it also registered with me that they cared about their jobs. They cared about what they were doing. I think one of the reasons why it's important to have a strong emergency department is the community, one, should feel like they receive quality care, and two, it should be aesthetically pleasing. People should be proud of their hospital, and they should say, that's my hospital. If I needed care, particularly in an emergency, this is where I would go to get it. So those things are very important, actually. How you feel when you first walk into the building, what you see, what's communicated to you before you even are introduced to a staff member or a professional. So I think one of the biggest things is that it will inspire confidence in the quality of care that you're receiving, but two, it will inspire pride from the community that this is a place we can be proud of.
The new Hirair and Anna Hovnanian Emergency Pavilion will direct both ambulance and ambulatory patients to the same entry point, ensuring that all patients are uniformly triaged at intake. Placement of the state-of-the-art diagnostic equipment will allow for efficient triage of urgent injuries and life-threatening conditions. Radiology services will be in the front of the emergency pavilion to provide quick access to diagnostic procedures. With a large local geriatric population, it's important to rule out a risk of stroke for an incoming patient. So CT scans in close proximity allow patients needing immediate interventions to be quickly treated.
My name is Kenneth Aaron. I was born in Brooklyn in the year 1923. That puts me at 98 years old at the present time.
My name is Joan Garin. I'm Ken's wife, and he did something he wasn't supposed to do because he has a walker, but he went to pick up the package at the front door and he fell. When we got to the emergency room, by the time I parked the car, he was already inside, and very swiftly, we didn't have to wait at all. And when they took him in, the room was immaculate. It was very clean, and everybody was perfect, and they really helped.
Would recommend the services of community without question.
This is not our first time here, and we've never had a problem.
The new floor plan allows patients to be treated quickly and placed in the appropriate locations to accommodate their health needs. Designed with an understanding of the needs and demographics of the Ocean County community, the new Hirair and Anna Hovnanian Emergency Pavilion is geriatric and family sensitive. The new emergency pavilion includes a sensory room, constructed with sound-absorbing materials, soothing colors, and adjustable lighting to better treat our patients with sensory disorders and unique needs, calming all who are already stressed. Equipment is strategically placed to accommodate limited mobility.
Hi, my name is Ryan Blumenthal, and I own Corinne Jewelers in Toms River. And my family has lived and worked in Toms River our entire lives. And we've always been a big supporter of Community Medical Center and all the wonderful things it does for our community, including the annual wine tasting event that is so popular. But I've also experienced Community Medical Center on a personal level too. Most recently, my son breaking his arm a true traumatizing moment for any parent, but we were handled with such a high standard of care, from checking us into the emergency room to the nurses and the doctors, and I really couldn't say enough nice things about the emergency room at Community Medical Center.
Through the physical redesign of the Hirair and Anna Hovnanian Emergency Pavilion and the training of the dedicated medical, nursing, and support staff, CMC will provide urgent care as expeditiously as possible in the most accessible way. We thank the Hovnanian Foundation for helping us to make this emergency department renovation a reality.